Assalamu alaikum. We'll start communication today. We have Mr. John, 30 years, and the relative Mrs. Brandon, the mother. Mr. John was having RTA with a skull fracture, subdural hematoma, residual left side weakness, craniotomy done to evacuate the bleeding. Completed 5 months now in the rehab ward. He can eat and drink. The left side weakness still present. Needs support more. He also occasionally has seizure, bowel and bladder incontinence, static conditions since 6 weeks. The consultant decided to discharge him home, and if not possible, the consultant asked to discuss the option of nursing home admission. Discuss the situation with Mrs. Brandon, address the concern. Let's start, and that time will be shared.
Okay.
Okay, ready?
Ready.
Here we go. Hello there, I'm Dr. Mukhtar, the doctor in the ward today. You must be Mrs. Brandon.
Yes, doctor.
You are the mother for Mr. John, and he is 30 years.
Yes.
Yeah, I'm here to discuss about Mr. John's condition. Is that okay for you?
Okay.
You are the next of kin for him.
Yes, doctor.
Okay, let's know about his condition. What you know so far about him?
Yes, doctor. My son just had this trouble RTA, road traffic accident, and they told me, the doctor told me at that time, he has bleeding inside his brain, and they need to do a urgent surgery just to remove it, remove it from his brain. And they did it, and then after that he improved actually from when compared with during the admission. If you actually, I was very afraid that he is going to die, but now his condition is improving, doctor, and thank you for that, doctor.
Yeah, I appreciate your knowledge about Mr. John's condition, and yeah, I appreciate also your concern. Before going further, if you want any question or concern, you can stop me and ask me anytime. But before going, may I ask you, what's your expectation about the meeting today?
No, doctor, I think you are going to just to put more plan for my son.
Yeah, I appreciate your concern, Mrs. Brandon. So, if you want me to explain more about the current condition, or I will go further for the management plan.
Yes, the doctors already told me everything about his situation and his condition. Thank you, doctor.
Yeah, I appreciate that. So let me discuss the last decision from our consultant. After Mr. John being the same condition, let's say it's static condition since 6 weeks now, he's able to eat and drink. Apart from the weakness and loss of control on his bladder and his bowel, so he just needs some support. And according to our consultant,
Now we will say bye to the
he
phone.
decided to he can be discharged home. Of course, after talking to you today, what's your opinion about that?
No, doctor, no. It's better for him to stay at hospital, doctor.
Sorry, I can't hear you.
It's no, doctor. I think it's better to stay at the hospital because he is improving in the hospital. If you saw at that time when he had RTA, he was in horrible situation. But I can see that he's improving now here in the hospital, doctor.
Yeah, I appreciate your worry, Mrs. Brandon. Let's talk about the pros and cons for the staying at hospital or going home Or we have another option, what's called nursing home. So if you want, I can explain to you.
Okay, what is this?
Yeah, so the advantage of discharging Mr. John at home, he will be adapted at home. He will be in the environment for being familiar and with his family members instead of staying at the hospital with the patients. And for the psychological point of view, I mean the mood, he will be fine, much fine if he stay at home. So apart from this, he's liable to have infection from the hospital, which is the environment for the patients and the diseases and bugs. So it will be way better to go home. Did you get that?
Yes, doctor, but will the nursing care will be the same as the hospital? Because I'm afraid that if we went to this nursing home, his condition worse than before.
Yeah, I appreciate your worry, Mrs. Brandon, but let me assure you that the same quality of services here is optimized and it will be the same will be offered in the nursing home, even at home with some nursing support or with some instruction how to do that at home. Is that okay for you?
Yes, so well, doctor, as they will care him at this nursing home, so why not stay in the hospital? What the advantage is to stay at nursing home, not in the hospital?
Yeah, I appreciate your concern and your concern is valid. Again, I'm reassuring you that the offer and the quality and the services will be offered at nursing home the same as we are offering here. Nothing to be changed or different because already we reach the maximum and the best of the care and the condition for Mr. John that he needs in the hospital, and it will be also the same as well as in the nursing home. Did you get that?
Yes, doctor, thank you. So will be there is doctor in nursing home or only nurses?
Yeah, I appreciate your concern. There will be a nurse. However, if you need or any emergency situation, they can call a doctor and he can attend immediately.
So no doctor at the nursing home?
According and up to my best knowledge, he will be around, but he will not be inside the same nursing home. But he can reach within minutes or within, yeah, minutes, let's say.
But doctor, you know that he has seizures, so I'm afraid that when he develops these fits, there is no doctor.
Yeah, I appreciate your worry, and let me assure you that the nursing there are skilled and professional, and they are trained and well trained how to manage if any patient has a seizure because they are dealing with the such kind of the same condition as Mr. John have.
Okay, thank you, doctor. So, well, as this nursing home, actually, doctor, I hear from my neighbor that there is good nursing center in Canada. Can I take my son there?
Okay, we can have another meeting, Mrs. Brandon, but let me tell you after transfer Mr. John to that nursing home, we can arrange that in another meeting and to see what the process for that. Is that okay?
Okay, okay. So, for how long I will stay in the nursing home, doctor?
Yeah, I appreciate your concern. They can sit with you again in another meeting according to Mr. John's condition in the coming couples of weeks and months, and according to his improvement, if he can go home or no.
Okay, okay.
Okay.
Okay, just I have last one question, doctor.
Yeah,
Is it expensive or can I afford this? My insurance afford this one?
yeah. Actually, I'm not sure, but what I know, that every service is related to the uh, medical insurance, it will be provided.
Okay, thank you, doctor.
Okay, can I ask you some question?
Yes, sure, doctor.
Okay, who was taking care of Mr. John at home
Actually,
before?
doctor, I'm only one to take care of him. I'm always support him. I'm a single mom, and that is why I prefer to stay hospital rather than go home.
Okay, I appreciate your care for Mr. John, and let me assure you that he will be fine, hopefully, and he will be home hopefully soon. Okay, I can give you some instruction in case Mr. John will go home. For the seizures, it's better not to leave Mr. John alone at all, at any time, and yeah, uh, don't let him in a noisy area or environment. It will trigger the seizure. And if you need anything and any help, you can call us immediately. You have any other concern?
No, thank you, doctor.
Okay, thumbs up. Actually, you have a lot of concern. You didn't leave me to ask you any question.
Yes.
But it's okay to learn from the concern and the answers. Let's
Mm.
hear the comments. Yeah, please start.
From the start, but as general, you did perfect, and definitely you will get full mark or 15 out of 16 at least. You approached the case
Thank you.
perfectly. Just apart from the last, I think, two concerns, but you promised her that you will arrange another meeting with her to address. You search about the answer, and or you need another meeting to address other concern. You start the case perfectly, and but my only comment that I think you should for your task is situation discharging home. So I think it's better to put more offer um,
Yeah,
effort in convince her to
going
discharge
home. Yes.
going home, and because you just ask one question and then directly went to nursing home.
Yes, you're
So
right.
yes, I think regarding the starting the case was perfect. Explain her this he reached maximum care, and the why it's better to go home. And the best thing that you have done that you explain the nursing home. It's like home environment. You can, and even you can add there is group therapy sessions, and better social activity, and you just explain this perfectly. Um, Regarding the concern that will be doctor in the nursing home, yes, it could be there is nursing doctor in the nursing home. By the way, even either resident doctor or visiting doctor.
Or family
Actually,
medicine. Yeah.
yes, it could be it could be resident. It's just at the nursing home, or could be visiting
Mm-hmm.
from time to time, scheduled
Mm-hmm.
with cases that need to be need a special care.
Mm-hmm.
Uh, Regarding the concern I hear from my neighbors, there is good center in Canada. Can I take my son there? Here's the best response for this concern. Appreciate your concern. We have similar excellent center here. So one can, whatever the center, you just mentioned as general that we have excellent center, similar center here. But yes, this is your right. If you choose to take him, this is your right, and you can take him the place that you want to get the health care. About the last concern that uh, can my insurance afford or afford the expenses of the treatment? Oh no, before that, how long should stay there? I think this long stay at
Yeah.
nursing home. um, of course you cannot mention exact date, but
Mm-hmm.
it may tend to
Might take
years.
long. Yes.
Yeah, take long. And regarding the last concern, that will my insurance get or afford cover the expenses of the treatment? You don't need to go deep or in further detail. Just I will give you a contact number of health
Mm-hmm.
commissioner who will inform you
Yes.
about it. Yes,
Yes. Yes.
health commissioner. I mean, a contact number of health commissioner, and who will give you advice about this matter. But as
Yeah.
general, you did perfectly, Dr. Mashallah, Dr. Bas.
Thank you, Dr. Abdul. Yeah, nice scenario, by the way. And the concern also, some of them are new for me. Uh, yeah, I prefer to face it in the training session, not in the exam.
I think
Especially
this
the,
scenario appeared, I think,
yeah.
2023, I think, or date 1, 2024, I'm not sure, but appeared
Mhm.
recently.
Yes. Yeah, it's a familiar one, but still the concern, I think you created some news concern, which is better to
Yeah.
hear it in the session.
Yes.
Yeah, like the doctor in the this first time to hear this concern, the doctor in the nursing home
Mm.
and the provided insurance for the nursing home as well. Yeah, but again, the advice for me and for all of us, if I don't know either to refer or to be diplomatic in the answer, yeah, it might be provided, but let me ask or let me refer you to the specialized or the assigned office to answer that or to address the concern. Yeah, I'm advising myself as well because I said also it might be, but still I didn't give clear and sharp answer. So better to refer to the specialized and the assigned and the concerned person or office or authority, whatever, who can give you the exact answer. I'm not sure, so better to be arranged with meeting with the company or with the insurance or as you said, commercial, any specialized or assigned office. Okay. Thank you for the case, Dr. Abdul Manam.
Thank
Very
you.
nice case and the concern as well. Uh, Read your scenario because uh, I will give you 2 minutes until we collect the comments and question. You can read the scenario on the screen.
Yes.
We
You
can
can
add in
read
this
it.
scenario to that is the cons for staying in hospital, that he can
Yeah.
catch infection and there is time limit for visit, and there is better social activities
Yes.
and
Community.
uh,
Yes.
community. Yes, good community in
Yes.
the home
Hmm.
nursing.
Yeah.
Uh, Other thing, I think there is doctor in the
Yeah.
nursing
Yeah.
home.
Yeah. Yeah. Mm.
Mm,
Dr. Abdulmena
okay.
already mentioned. And yes,
Yes.
again, it's okay to repeat just to confirm the
Sorry, I
information. No,
maybe
no,
I
no,
didn't
no,
concentrate
no,
in
Dr.
comment.
Aisha, at all,
Okay.
no, no, it's okay. Even others might not, didn't hear it, so it's okay to repeat because maybe someone wasn't concentrated, and the
Mm,
repetition also will be helpful for all of us. Even for me, when you repeat, I will again confirm it. So
mm.
let's repeat again. The
You
advantage.
discussed first about if staying at home, صح?
Actually, I
Uh,
gave him the option of home, and he was so denying for the home. So I gave him the second option from the first sentence.
mm.
But suppose,
So
yes, you're right.
if he ask you what time he can go home, uh, you said it is any time he can go home if you will care about him or anyone care of him.
Yes,
I
yes,
think
yes,
because the
yes.
first
If
option already was
yes, the
home.
option, yeah, the first option
Uh,
was home. So it's okay to go home. But if you don't
yes.
have someone to take care of him or look after him,
Yes. If
he
he
can
ask if
stay in the
his
nursing
condition
home.
will improve, you will answer like you answer. But if he said what time he can go home, you can said anytime you have someone to care of him, and
Yes.
we learn you about how to care. You can take him
Hmm.
home.
The
But
concern
if
was
he
for
ask,
how long should it stay at nursing home, not going home.
Yeah,
oh,
Yes.
he need care
yes,
يعني for how long he need care or
He will staying
staying. So
in nursing
if
home.
this which
no,
is the
no,
answer, will also he can go home
yes,
at any
he
time
Yes,
and
can
we
go
will
home at
support
any
him
time.
at home.
Yes, yes, because
exactly.
he's
Okay.
already this yeah. But I think the new question here also Dr. Abdulmanem raised, can I take him Canada? So this it will be as a flight and need another arrangement. That's why I give him different answer, which is if he's
Yes.
suitable to fly or to go through a flight or to be discharged from this area to another country, this one need
Mm.
to another to be arrange another meeting, how to process that. But he can. Okay, if she asks more,
Yes. Yes.
yes, I think now how many 5 months in the surgery, so it's safe to fly. If she asks about the flight itself, but I make the answer again as diplomatic. Let's arrange another meeting for this issue particularly because I can't give you guarantee right now because the meeting is not for transferring him another country. But if the question clear about the flight, I think he will be safe to fly as long as the surgery was 5 months back. This is another concern which I like in this scenario, if I can take him through a flight to another country. But definitely, yes, she can take uh, whatever and whenever he's stable and suitable to fly. In another session or another meeting, we can do the process for that and the arrangement for that. You got it, Dr. Aisha. Thank you for the comment again. Let's repeat the point of why not to stay long in the hospital. Yeah, by the way, I mentioned it, Dr. Aisha, about the infection. Yeah, he might catch infection from the hospital. This is one of the serious disadvantage and complication might happen in the hospital, and it's safe in the other area because the nursing home will not have sick patients as in the hospital. So he will be more safe from infection and catching the infection.
Yes.
Plus
And the visiting
yeah,
some
this
is
is
a visiting
another
time.
good
Yeah.
point. Yes, exactly. I
Mm.
agree. Yes, this point also good to mention because the visiting time, even the accompanying time, he might it might be longer than in the hospital, and you can stay with him. I think in the nursing home more than in the hospital. Plus the community itself, all patients in or let's say they are not patient comparing to a disabled patient or disabled person. They are not sick person. They are like disabled. They can't move. They can't sit. They can like yeah some residual weakness. Some long-term patient. I mean long-stay patient who does need only some care. Uh, apart from that, they are aware and conscious, so they can communicate together, and they are having the same problem, which is disability or movement disorder. So it will be much better than staying with sick patient has serious diseases and maybe they are not aware at all. And this is also another. So you can create a lot of for advantage in the same around the same point, which is people who are safe to stay with, community better than the in hospital, even the social surrounding, maybe there is park, there is some games. I think that it's not like the hospital. The nursing home will be much enjoying than the hospital itself. They are trying to prepare the patient to go home, and it's the last step before going home. Okay. Thank you, Dr. Aisha, again for reminding. Any question or any comments anyone want to add? So, Dr. Abdulmanan, did you read your scenario? Are you preparing yourself? Okay, take your time. I will read the scenario just to be to loudly so all will hear the scenario. Mrs. Anderson, 80 years old, known to have diabetes. She was contacted by the diabetic clinic to arrange outpatient telephone appointment with the diabetic consultant. She received the letter of the appointment, which stated that She should answer the phone call by the clinician, which is supposed to be yesterday 1 p.m. from 1 p.m. to 1:30 p.m. But Mrs. Anderson didn't pick up of these phone calls. It is noted that Mrs. Anderson is suffering from hearing difficulty and was advised before by her GP to use hearing aids, which she wasn't accepting to use. You are the medical senior house officer of the diabetic clinic today. Your task is to sit with Mrs. Pamela, the daughter of Mrs. Anderson, as she is insisting to see her mother doctor. You are not supposed to take any history from here. If you're ready, Dr. Abdulmenem, let me know.
Yes, let's start.
Okay, let's start. I will share the timer.
Hello
Here you
there.
go. Yes. Hello.
My name is Dr. Ahmed, one of medical doctor in the clinic today. May I confirm that you are Mrs. Pamela?
Yes, I am.
You are daughter of Mrs. Anderson, 80 years old.
Yes.
Are you the next of kin of Mrs. Anderson?
Yes, I am.
Mrs. Pamela, we are here today to discuss some issues related to your mother's health status. Is it okay with you?
Sure, doctor.
Before we start, just to be in the same page, can I know how much you know about your mother health status?
Yes, doctor. What I know that my mom had a last appointment recently, and they told her that they will call her. And my mom having some problems in her hearing. However, she's using her hearing aids. I don't know why no one called her yesterday to give her the next appointment.
Sorry again.
Yeah, no one called my mom. According to them, they will call my mom to give her next appointment, and no one called her.
Well, I highly appreciate you. I highly appreciate your concern, Mrs. Bamilla. I'm here today to just update you about what happened to your mother's appointment.
Mm-hmm.
Okay. Well, the treating doctor who should call to your mother, he called her many times, but unfortunately, he mistaken that she is complaining of this hearing problem, and yes, this is a mistake. This is an error which should not be happen.
What you mean, doctor?
Well,
You
doctor,
mean that?
well, Mrs. Pamela, because the treating doctor, he called her many times, but this was mistaken to not aware about her hearing problem. I am sincerely apologize about I'm sincerely apologize about what happened about your mother appointment, and this is unintentional, but it's not acceptable at the same time, Mrs. Pamela.
Okay, you mean that he called her and you are not believing me, she didn't pick up the phone?
I highly appreciate your concern, Mrs. Pamela. They call her, but the problem that they not aware about they mistaken about the health status about the hearing problem. So the problem that we should be aware about this and call more often than this.
Mm-hmm. So, doctor, you mean she lost the appointment?
I highly appreciate concern, Mrs. Pamela, but we will arrange regarding this as soon as possible. As soon as we discover that she missed the appointment, another appointment will arrange soon, and the incident report will be raised about this issue, and they will inform the general they will inform the consultant and supervisor who are responsible for the appointment, and they will inform risk management team. They are responsible to know why this has happened, and to know how this is exact happen, and to prevent this happen in the future again. Am I clear, Mrs. Pamela?
Yes, doctor, but why you didn't give her appointment while she's visiting the clinic? Why you want to give her the appointment by phone?
Well, this actually this decided by the treating doctor. This regarding her condition, and this decided by the consultant to this appointment be done through phone.
You mean there was no appointment, and when you discover that there is available appointment, you call mom to give her that appointment.
Sorry.
There was no available appointment, you mean, when she was there.
Uh, to be honest, I didn't know about what happened at that time, but
Mhm.
at least let me check with the doctor that he arranged the meeting. Why he didn't arrange in-person meeting, rather than phone call meeting.
Yes, doctor, please. I don't like to be using the phone as a method to give appointment or uh, to contact my mom. You know, my mom is having hearing problem, and
Yes,
she is not hearing her hearing aids.
yes, I highly appreciate your concern. Actually, this is not usual practice, but I assure you this since this happened, they will discover and why this happened, and the result of this risk management team will be discussed in a meeting to know why this happened, and to prevent this happen in the future. And we will make a special arrangement for anyone who has a similar condition as your mother, to prevent the missing appointment in the future. I
Okay,
hope this
doctor.
clear, Mrs. Bamila.
Yes, it's clear now.
Yes. Do you have any concern or something you want me to read?
No, doctor, I understood everything, but let me know when will be the next appointment. And I hope it will not be again by phone call.
Well, this will be as soon as possible. And I will check by myself, and I will arrange the meeting with the consultant. So, and to just get the best plan of management and care. I hope I understand this point, Mrs. Pamela.
Okay, doctor.
Well, may I ask, um, may I ask some question if you don't mind?
Sure.
With whom Mrs. Anderson live with?
Actually, I am living with her, but not all the time because I have duties. So she's living alone some of the day, but at the evening time, I go back from my work.
Well, in this case, if you need any assistance in from us, we will be happy to help you and to give support to the Mrs. Anderson, and we will refer you to social worker and we see how we can help us in this matter. Is it okay
Okay,
with you?
doctor. Yeah, it will be so great, doctor. Thank you.
Okay, thank you. Are you Mrs. Anderson financially supported?
Yeah, doctor. I can take care of that. No worries.
Okay. Do you have any other particular concern?
Actually, doctor, I want to know the name of the doctor who called my mom and the one who missed her appointment.
Well, I highly appreciate concern, Mrs. Pamela. But here in the hospital, we work as a team. So about this mistake, we all responsible about this happened. So we that is why no we all responsible for this mistake, and we all that is no one particularly is responsible for this mistake.
Okay, doctor.
Okay.
So you promise me that you will give me as soon as possible an appointment for my mom, and it
Well,
will be a face-to-face appointment, I mean, in the clinic.
well, Mrs. Pamela, I will check the appointment with by myself, and then I will ensure that she has the consultant has a free schedule, and I will schedule with her to be in person.
Yeah, I
I
hope
hope
so, doctor.
this is clear, Mrs. Pamela.
Yeah, doctor. Thank you, doctor.
Do you have any particular concern or something you want me to read?
No, doctor. I think I got what I want from you now and today.
Well, at the same time, I highly advise you advise Mrs. Anderson to wearing this ear. May I ask why she don't want to wear this hearing aids?
Okay, time is up. Let's. I will extend for the consent only. Yeah,
Okay.
doctor. Actually, the old and the elderly persons, they are hard-headed. She doesn't like. I don't know how to convince her.
Well, if you want us to arrange a meeting with Mrs. Anderson, we have a specialized who will responsible who convince may be able to convince her. They will give her the information piece by piece, so to ensure that the importance of the hearing aids.
Okay. Who's that team, doctor? What's it called?
Well, this we have a department called that. Those department who has equipment, I mean this hearing aids, they
Okay.
are yes, they're responsible for to convince the some case like
Okay.
your mother, yes, about this.
So they are occupational therapists
Yes.
who's giving, yeah, the tools and provide tools for caring and support the patient. Thank you.
Thank you.
Yeah, I think,
Thank you
yeah,
for
time
talking
is
with
up.
me.
Thank you too. Okay, well done, Dr. Abdulmanan. You did
Well,
it.
is it error, medical error, or error overall?
The best thing here that you didn't insist, it's like the mistake from the mother side. It's okay to assume that it's related to the medical team side, but don't blame the mother at all. Yeah, so what
Oh,
you did, yeah, is perfect. Okay.
okay.
Once you will blame the mother, why your mother didn't hear the hearing aids, because your mother is not hearing the phone, yeah, you will be in trouble. Because suppose not to give the appointment by phone, even if you will do so, you should be sure that she will hear the phone by the hearing aid, which is not hearing it. So better to assume and pretend that the problem from the medical team, not from the mother, because you have to believe the patient and the relatives. Okay, don't say, no, we called her and she didn't answer our phone. The problem from your mother because she's not hearing her hearing aid and so on. Okay, you will be in trouble in this point. So to be guilty about the team, better not to, better than blaming the patient or the patient mother or whatever the situation. Okay.
Okay.
So what you did, yeah, is great. Better to do like this. Let's start from the beginning as a comment. Introduction, the next of kin, what you know about your mother, and what's your expectation about this meeting. It might give you also a hint about what's going. Okay.
Okay.
Then, yeah, you blame the team or you assume that the problem from the team, and it was unintentionally that this happened. Yes, it's great to mention that because suppose not to happen. suppose, as you said, in person, they will give her appointment and no need to be in contact or for phone arrangements since she is not hearing the hearing aid. And again, don't blame or don't assume that we called many times, but your mother didn't answer the phone. So you can say this a problem from the medical team. Okay, then you correct the problem by giving a phone appointment, and it will not be also phone arrangement. It will be in person or face to face because she is diabetic and has a lot of problem and a lot of follow up, and still she's not hearing well. I think the risk management team here is, I don't know, is it appropriate because what the risk in this patient to arrange with?
Sorry?
So the risk management team.
Yes. But because I'm confused, my question is, should I apply full duty of contour or no? This is a clear error or no?
Yeah, that's why I told you what you did better than assuming that the mistake from the family or from the mother.
Okay.
No, okay, let's answer this question in the chat later. Okay, so the next appointment, I asked you for the next appointment. You told me, yes, I will talk with my consultant to make the appointment as soon as possible, and so on. When I ask you also what happened, you told me, yeah, I don't have clear idea about what happened, but I will be contacting my consultant or my team to know more about the situation. Then I ask you clear question, do you promise me that the meeting, the appointment will be soon? Don't give promise as you did. Don't say I promise you. Just say, yeah, we will try our best to give an appointment as soon as possible without any promise. Then the social support, who's living with your mom, who's supporting her, and the area of financial support. I think the mother now is not in need for financial support. So no need to ask about the financial. The max or the best support you can offer here is the social support, the like the caring, the surrounding, the even the occupational therapist support, which is hearing aids. So this is much better to ask about than asking about the financial because the patient already retired. So the one who take care of her, who's the one will be supporting her financially, I mean. But you can ask this question if the patient, for example, is still in the working age, like 30s, 40s, and he's dependent on his job and he's sick now and he doesn't have any support. Now, at that time, you can ask about the financial support. Okay. So instead, you can ask who's taking care of her, who's supporting her. Does she do her daily activity well? Does she do dressing herself well? And you can offer according to her answer. Yeah, she is not able to do, so we can offer her some support or some social support. Okay.
Okay.
Then the last, yes, I added that question at the end. Who's the team assigned for that? They are the occupational therapists.
Okay.
They are the one providing hearing aid, and you'll sit with her to convince her to use it. Anyway, it's not again for only the appointment. It's just to be adapting her life without any problem. Like if something happened without hearing the surrounding, it might be trouble for her. So better to hear it to adapt the life around her. Okay.
Okay.
Yeah. Please, Dr. Abdulman, because I can't see the message again. The Zoom is hanging. You can read the question because I can see the message come, but it's not open for me.
في بس
Um,
one comment.
Yes, Dr.
I
Aisha,
think
yes.
when he answer you this
يلا
is
مع
not
السلامة.
always
يا رب
way.
التوفيق. ستي حاجة المكياج هناك.
Okay. Sorry, can you mute? I can't mute even the. Please mute yourself. Yes, Dr. Aisha, go ahead.
If when he ask why the appointment by phone like that, he replied, "This is not the usual way, but this is a
Mhm.
usual way." So
Yes, I
you
know.
will said I'll just report in her file that this way not
Yes, matching with her
suitable
file.
for your mother.
Yes.
So after
Mhm.
that, we can make your mother appointment to attend the clinic. Because this way of communication
Yes.
or for follow up
Still
not
present,
suitable for
yes.
you. But
Yeah.
this is a
But
usual way for follow up
yeah,
in
it's valid
clinics.
for others. Yes, it's valid for others.
Mm.
That's why, yeah, I accept it for other patients. But in this situation, uh, Dr. Kadir, what is it medical error? It's not medical error. No, the error here or being sorry for that, they know that she's not hearing the aids and they give her a call to arrange appointment. Yeah, the daughter's supposed to be at home and pick up the phone, but if
And
the
I
daughter
think
is not
when
at home,
he asked why she didn't wear, I think it's not also in this communication because we
uh,
can't ask about history. And
yeah, but the main concept of the scenario due to that, because she's not
yes, I
hearing
know,
the
but
hearing.
already he mentioned to you that she refused after and trying to persuade her and trying to advise, but
Mhm.
she refused. So you are not for this page now uh, counsel about using this aid because this is not the
Yeah,
mother.
okay. We can say that it's not to be asked. He can instruct that. He can say as
Yes,
advice.
advice only. I
Yeah,
advise
yeah,
to make another appointment with
yeah. With
he
your
can
mother,
arrange
yes.
we can arrange another appointment
A
with this
meeting. Yeah,
occupational therapist. He can advise and he can know what
yes.
is annoy your
And
mother
solve this
about this
problem.
aid and solve this
Yes,
problem. Yes, but
yes.
don't
I
ask
agree.
about the cause.
Yes, I agree. Maybe as taking history. Yes, you're right. Okay, Dr.
Actually,
Aisha, please go.
we can
Yeah.
also give some suggestion as as solution for the situation I heard from previous same
Yes,
scenario maybe to give like a vibrating alarm she can wear. Now everything is present like smartwatch, flashlights, vibrating
Mhm.
alarm that will make her more
Notify. Yes. Mhm.
yes, like
She
this
can
if a
but
notify.
this
call
I
came,
think
Yeah.
if
from
it
also occupational therapist. You will not
Yes.
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 no time to discuss this. I think in this situation also.
No,
But
no,
this
can
is
be one
another solution. If
suggestion.
she is not
Yes.
wearing her hearing aid, she can be at least
But
she
it's
can.
She
for
can
the
notice what's
scenario.
ongoing around. Yes, yes.
Yeah.
Yeah, I agree. As a suggestion, Dr. Aisha, it's not also taking history. It's a suggestion for the next time for the because also still this is not the permanent solution that we will give her in person meeting. Yes, we will try to do so, but maybe you are busy. We don't have the appointment available appointment. So again, we might send her home and we can call her and the problem we can solve it by either wearing the hearing aid or as Dr. I can see the name, sorry, Doctor. As you mentioned, by alarming or vibrating or light in the phone just to notify or to notice the call. So I think all these valid solutions to do and good also to raise such issues because maybe someone hear this scenario from other candidate who got the full mark for this scenario and I hear from others another candidate so this meeting for that to collect the ideas and the solutions how to solve every concern because sometimes the mentor also they don't have the whole background the mentor just helping, but they don't know. Maybe one doctor and candidate pass with solution he offered, and the mentor he doesn't know about, right? So if some candidate pass and his friend hear that solution and he pass, so we can do so, and we inshallah hopefully we pass. Okay. So it's accepted, Dr. Aisha, to suggest
I
that
think
such
accepted.
solution.
I have no problem,
Yes.
but I think the
Yeah.
time. But you notice that the doctor he because he asked this question, no time for him. So you will
Yes.
finish the scenario. If you have time, you will add some advices.
Yeah. The scenario will not go with every person or candidate as the other.
Yes,
The
I know, I
scenario,
know.
yeah. So you might drive the scenario from the start by giving solution. Others,
Yes.
no, he
Mm.
can hear what's happening and he can try to solve the problem as a mistake from the hospital, why they didn't reach to here. So it's not fixed drive or fixed way to drive this scenario. But accordingly,
Yes, you are
and
right. You are
maybe
right.
all of them will pass. Yes, that's why we are in this meeting. So here, the communication is not A, B, C, D. Yes, there is a skeleton to follow, but you might start by the concern and end by the other red flag. Others might start with the red flags and ending by the concern, and both of them will pass. So this is the aim of the meeting, to have skills and collect the idea how and the point how to discuss with the surrogate and finish the task and get the full mark. This is our aim. So I think it's valid solution and suggestion. Dr. Aisha, because you're here with us, you can read the comment because still my Zoom has problem. Any comment we can answer? Because
Okay, I'll read from start,
uh,
sir. You didn't read
yes,
any.
please. Yeah,
Okay,
I can't open the message. Yes, please.
okay. Can we ask the daughter number to call here if needed? Yes, very good point.
Yeah, yeah,
Really, yes, very good point. From solutions
yes,
also.
yeah. To
To be the one
communicate with the
contacted
daughter.
instead.
Yes,
Yes,
exactly.
very good.
Yes, yes.
But we maybe add to you can let mother know by this or make you like to be confidential يعني that the mother will allow you we can discuss with
Yeah,
mother to
but the
allow
daughter,
us
by the way, the
to
daughter is
contact
next
you.
of kin. Yeah, but the next of
Yeah.
kin. So
Okay,
she's the
okay. So
one.
no
Yeah.
need. Okay. Okay.
But
Make it to go.
also one point, doctor, because it is usually a phone consultation. It is not
Mm-hmm.
just a call to inform the patient that your appointment will be on that date or this hour. It is
Yes.
usually a phone consultation. So this should be done with the patient herself.
Yes.
In this situation, we cannot do the
Yes, we
consultation
can.
with her daughter.
Yes.
Yes, that's why
No,
we
no.
have to give her something to alert her to take the phone and answer the phone.
All the solution how to give the mother the appointment to meet her, because by the phone they can't have the consultation unless she
Just
will
to
hear.
arrive to her because
Yes,
if
exactly.
she already aware about the phone she can wear the aid they can
Exactly.
make
Yes.
like the voice more high the son
Mm-hmm.
can inform by any information because the phone consultation not very long just for refill medication to know how she with
Yes,
medication
can be, but if
not
she
long
can hear
consultation
us, yeah, but if she can
if she
hear
can
us, yeah,
yes
but
okay
don't
but this
assume
is
that.
possible solution. Mm.
Yeah, don't assume by any way that you called many times and your mother ignore our call. Don't assume that at all. Okay, don't say,
Yes,
yeah, no, no, we called
not to
her,
make
but she
conflict
didn't pick
with
up. Yeah,
surrogate.
no, don't argue with her. Yeah, don't argue with her because the argument
Mm.
itself means that you are not believing the daughter. So yeah, don't do that. This is the most important and the take home message from this scenario. Don't assume that you call many times and your mother is not picking up phone because she's ignoring us or she's not because she's not hearing wearing her hearing aid. So don't blame the mother. Always blame the team or try to make the error or the mistake from the medical team and try to solve this. This is the way how to trust the surrogate and trust the patient. Okay, go ahead, Dr. Aisha, if you have another comment.
Okay, the next who reply to the reform, maybe same thing will happen. I don't know, maybe in the middle of the discussion. This. What about sending email or letter for future appointment? I think the call for not for the appointment, it is the appointment itself. Is it pure medical error, guys? Because she already has hearing aid, maybe herself didn't wear. So we reply
Yeah,
about this. It's not a medical error. I think it is not a medical error. I have heard a mentor saying that it is not an error. You can be sorry and maybe apologize once, but no incident report.
no, we
Okay,
didn't
this
say
is good.
instant report at all. Yeah, Dr. Abdul
Yes, I
mentioned,
just
no,
he
didn't mention instant.
make like a confirmation about it.
Yeah,
It
yeah.
seems
Oh,
uncertainly more than error. We can't
uncertainty. Yeah,
feel uncertainty.
uncertainty
Okay.
means that you have to search about the situation and what happened. Still, we
Mm,
are not sure, and at the same time, don't be sure that the problem from the mother. Don't do that. Yeah, we are not sure from
okay.
our side what's happening. The number is wrong. Maybe the phone was not reached. So blame always your side. Don't blame the patient side. Okay.
Mm.
Yes. What
Okay,
else?
the same person said that we can't follow whether she wear or not our job to call in care, not reply for this. We yes, we feel sorry, but no
Anna,
rule of pure as rude. I think this is some
Don't assume, yeah,
like
that she
expressions
is.
I
Yes.
can't actually
Yeah.
understand. Okay. If we define medical error, it is not pure because harm is not happening yet, and still we can manage the situation. Okay. Can we ask for the daughter number to call her for the yes,
Yes.
this
Yes.
is
Yes.
another
You
the same.
mentioned.
Okay. Yes, this is the last.
Okay. So the take-home message: believe the surrogate. Don't assume that the mother, no, she didn't hear that, or she didn't wear the hearing aid because she doesn't want, or don't blame the patient. Don't put the mistake on the patient. Try to solve it without either uncertainty or problem from ourselves that the number was not clear, that we don't know that she's not wearing her hearing aids. We will try to contact you immediately as some suggestion. We can give her some vibration tools. We can solve the problem by occupational therapist. Any any solution you can offer, but don't blame or put the problem on the patient or the family. Okay? Thank you, Dr. Abdulmanan, and thank you,
Very good
Dr.
scenarios,
Aisha.
the both scenarios. Thank you very much for
Yes,
you
yes.
both.
Yeah, we
Dr.
are
Bassett, thank you
trying
so much.
to. Thank you, Dr. Abdulmanan. Even you are disappearing, but you are coming back with good scenarios.
Thank you.
So again, yeah, we're encouraging all of us to and you to communicate and to do the scenarios. Okay, inshallah. Thank you all. Thank you, Dr. Thank you, Dr. Adil. Thank you, Dr. Adnan, Dr. Aisha, and all comment, Dr. Fadi. See you tomorrow, inshallah, with long clinical consultation. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you.